Hello everyone. Today's topic of discussion is digital subtraction angiography. So that means this is somewhat different from conventional angiography, and how this technology is helping in diagnosing coronary artery diseases. That is the topic of discussion in today's video. So name of the imaging technique, this is an advanced imaging technique used in modern medicine, and name is digital subtraction angiography. In short, this is known as DSA. And how this helps in visualizing blood vessels, means actually how it helps in visualizing blockages or stenosis in blood vessels. That is the topic of discussion here in this video. So, coronary artery disease, this normally occurs when fatty deposits, which are also called plaques, exist inside build up inside our blood vessels. So in that case, there is an occurrence of coronary artery disease, and for which the patient may suffer from, in severe cases, heart attack, then cardiac arrest, chest pain or discomfort, which is also known as angina. So symptoms are what? Common symptoms include this chest pain or discomfort, then shortness of breath, then fatigue and dizziness, and in certain cases, in severe cases actually, heart attacks. So these are the common symptoms of coronary artery disease. And what are the risk factors of coronary artery disease? Risk factors are like diabetes, obesity, sedentary lifestyle, high cholesterol, hypertension, smoking. So these are the risk factors of CAD or coronary artery disease. CAD, this short form is used for coronary artery disease. So what are the steps involved in case of digital subtraction angiography? Means a few steps are involved there. Not a single image is taken in this case. So first, which is also called baseline image or mask image, baseline image. So an initial X-ray is taken without using contrast dye. An initial X-ray is taken without using contrast dye. Then what is done? Then via a catheter, an injection, which is known as a radiopaque contrast dye. So a radiopaque contrast dye is injected via a catheter into the blood vessels. So that is the second step. Third step, again X-ray is taken. That is the third step. Again X-ray is taken. That means here in this case X-ray is taken with a contrast enhanced blood vessels, because you have already injected a contrast dye into the blood vessels. So this is the second image. This is again taken. Second X-ray is again taken, and next step is by using computers. The final image, means the second image, the first image is subtracted from the second one. In the first image, contrast dye was not present, and in the second dye, contrast agent was present. So what is the advantage of subtracting this from the second image? First image was subtracted by using computers. Computers can do this job very well with high efficiency. In this case, what is done actually, unnecessary things are subtracted. Unnecessary things means like bones, soft tissues. In the first image, all were present. Blood vessels were present, bones were present, soft tissues were present, means tissues were present. So if you subtract this way, then in the final image only blood vessels are visible. That means the image becomes clear, and also you are getting higher resolution image. That means diagnosing the problem becomes easier and becomes accurate for the doctors. unnecessary things are removed this way by subtracting the first image, the initial image, from the final one. And this is the advantage of DSA, that is a digital subtraction angiography over conventional angiography. This is the main benefit. So this technique actually helps in angioplasty, placement of stent. Okay, so if there are blockages, if there are stenosis, if there is stenosis, if the patient is suffering from stenosis means narrowing of blood vessels, that is known as stenosis in medical sciences. So these things can be easily detected, means early detection of coronary artery disease is possible by using this advanced imaging technique. And that is why this is called a breakthrough in medical science, in modern medicine, or in medical imaging techniques. This is no doubt a breakthrough, this technique. Okay, and why this is called a breakthrough? Because this is able to detect a minor stenosis. Even minor stenosis is present. In that case, this technique is able to detect that one also. But limitations and risks are also involved because multiple X-rays are taken. So there is an exposure of radiation. Oh, okay. So that is the problem. Though this amount is shorter than the means smaller, not shorter. This amount of radiation is smaller than the conventional angiography. Advantage is there, again disadvantage is also there. Since radiation is present and multiple X-rays are taken, that's why risk is involved. That is the disadvantage of this imaging technique. Again, contrast dye is used. That is one more risk factor. That is a kind of disadvantage. Contrast dye is not well suited for all the patients. Few people are there who may experience allergic reactions due to this contrast dye. Even they may experience kidney complications due to this contrast dye. Though in this case, in case of digital subtraction angiography, lower level of contrast dye is injected. That is advantage. So advantages and disadvantages both are present simultaneously. Maybe in future all these disadvantages will be removed by the scientists and researchers, because they are not sitting idle. They are working on this field to make it more improved, to make this technology more improved. Improvement is required. So, I have already discussed the main points of this technology. So, this is an advanced imaging technique, okay, known as digital subtraction imaging. So, since early detection is possible, so early treatment is possible, and that is good for everyone. Okay. Anyway, so this was all about today's topic, and this is the end of this video. One more thing, if you found this video to be insightful or to be informative, then please like, share and subscribe to our channel for more science insights. Anyway, so this is the end of this video. Thank you for watching this video.